Our labor and delivery prep techniques are reserved for that 37-week mark and beyond. These are techniques you can do at home leading up to labor and delivery and utilize during labor, whatever feels good for mom. Sideline release is an awesome technique to apply counter pressure to mom's pelvis. This is an alternative to a hip squeeze, and this is much easier on the partner assisting. Use whatever pillows you have available to you to keep mom comfortable. But the most important piece is that mom's hips are stacked. You'll notice that her top leg can relax and lie forward. If that is not comfortable for mom, she can bring both legs together so they're stacked and bend her knees. For the partner that is assisting, it is just important that you keep those hips stacked and apply your pressure straight downward, straight down into the ground, and that your hands are placed just south of the top of her pelvis, where mom would place her hands on her hips. We want to keep her comfortable. Moving into some soft tissue work, in the home stretch, it's really nice to work on the adductors, the inner thigh muscles, as these muscles attach right up into the pelvis, into the pubic bone area. So always work towards the heart, start at the knee and pull or push towards the body, towards the torso. We want to do that just to help support lymphatic drainage. Sacral rocking is another technique to apply counter pressure to mom's low back and pelvis. Using the palm of your hand at the top of her sacrum or tailbone, you will apply pressure straight down again towards the ground with a little bit of a tuck or a rock on that sacrum. Now you can use your free hand on belly, below belly, to help pull belly up very gently while all of your pressure is focused on the sacrum. If mom is seated comfortably here or laboring on the back of the toilet, you can use both hands to just traction down on the sacrum and apply even more pressure. Communicate with her, but this usually feels really, really good to decrease tension. If you're not laboring on the toilet or on a chair, mom can also be supported on the wall or maybe a countertop at home, but you will do the same thing to help support that sacral rocking, just that tuck of the pelvis, and again, decreasing tension in her low back. Belly sifting can also be used to decrease pressure and tension on mom's low back in the home stretch of pregnancy. Using a rebozo scarf, belly is covered from the very top to the very bottom, and the partner assisting will pull up through the scarf equally with tension on both sides, and you will sift or shift and rock from side to side at a nice gentle pace, but with a good pressure. So talk to mom here about what she needs. You can generally be here for 30 seconds, upwards of 2 minutes. But know this technique is also reserved and used for breech babes in a mom with a posterior placenta. We generally avoid this technique with a mama that has an anterior placenta.